Hi, and welcome back to Dr. C's Morning Minute. Glad you could be here. I want to continue our discussion today about self-stimulatory behaviors with kiddos today that are on the upper end of the autism spectrum, kids that used to be called as having Asperger's disorder. These children and teenagers, and adults for that matter, tend to have more of an issue with their cognitions, with their thoughts, as opposed to their behavior. You may see some hand flapping now and again, but the bigger issue tends to be obsessing and fixating on topics. The way we deal with that, lots of different ways, of course. One of the primary ways is through more of a counseling approach, improving the child's insight, helping them to realize this is an issue and that there needs to be improved self-restraint in that respect. And not uncommonly, we get the kiddo on board to curtail the behavior in certain situations at certain times, helping them to improve in that respect as a result. It certainly helps if the child wants to make friends, because oftentimes they do. And again, this helps them to realize that this counseling approach helps them to realize that, gee, if I want to have friends, I need to show more self-control, and that can really increase levels of motivation. It can be more of a challenge if the kiddo is less motivated toward friendships or doesn't have the insight or as much insight as we would like in terms of recognizing that it's a problem and gets in the way. But again, this is a process, and sometimes we'll do this more behaviorally by limiting access to certain topics or interests. In other situations, it's more trying to get the kiddo on board so they limit it themselves, or a combination of the two. Either way, we do tend to see pretty significant progress and success in that respect. And so, but again, not uncommonly, it's a situation where professional intervention can be quite helpful. So always feel free to call the office and get in touch with me and we can talk more about it, okay? All right, so see you next time. Dr. C's Morning Minute.